problem solving. Irritated and red skin. The skin around the stoma may become irritated and red if it comes into contact with urine from your child's ostomy. The best action to prevent this is to keep the opening of the skin barrier as close to the edge of the stoma as possible. Don't let your child wear the skin barrier for too long. Examine the barrier and check for any exposed skin or liquid seeping under the barrier. If there is seepage, change the barrier right away. Measure the stoma during each pouch change for at least the first 3 months after surgery. If the skin is irritated, weepy, or wet, apply skin barrier powder before applying the pouch system. Lightly apply the powder and then brush off the excess. You may need to apply skin prep on top of the powder before applying the pouch system. Barrier not sticking. If you're having trouble getting the barrier to stick to your child's skin, this may be because there is soap or residue left on the skin. Warming the barrier before putting it in place can also help. Some patients find using a hairdryer on low for a few seconds may help the barrier stick. If your child is using 2 to 3 barriers per day, contact a certified ostomy nurse for suggestions. Signs of infection. It is normal to have redness around the edges of the stoma while it is healing. If your child has redness extending beyond 1/2 inch around the incision or stoma, pain at the incision or stoma site, white or beige fluid draining, or itchiness and tiny red bumps, they may have an infection and you should contact your child's ostomy nurse or doctor. Dehydration. Keep track of how many times the pouch needs to be emptied each day. Watch for signs of dehydration, which include dry mouth and tongue, feeling thirsty, low urine output or dark-colored urine, irritability or dizziness, weight loss of more than 2 pounds over a few days. Call your child's doctor or nurse if your child has any of the above. They will guide you on what your child should be eating and drinking. Electrolyte solutions such as Pedialyte, Gatorade, or Powerade may be helpful. Bleeding. You may see a spot of blood on your child's stoma, especially when cleaning or changing the pouch. This is normal, and it's because the stoma has a good blood supply and no longer has the protection of your skin. The bleeding should stop within a few minutes. If you want, you can use a moist cloth and apply mild pressure for a minute. If you see blood in your child's pouch or the bleeding increases, call your child's nurse or doctor. Stoma prolapse. Stoma prolapse means the stoma becomes longer so that it sticks out or protrudes above the surrounding skin much more than it once did. As long as the stoma remains red and stays moist, this is not a medical emergency. However, we recommend that you contact your child's doctor and let them know this happened. Stoma retraction. Stoma retraction means the stoma is functioning at or below skin level so that it appears to be shrinking lower than the surrounding skin. It is extremely unlikely that the stoma will disappear, but stoma retraction can make it more difficult to maintain a good seal on the pouching system. This is not considered a medical emergency, but if you have problems with your child's pouch seal, call your child's ostomy nurse or doctor. No output from ostomy. Your ostomy is usually active. If your child has a 4 to 6 hour period with no output from the stoma and your child has nausea, you may have an obstruction. There may be blockage or internal changes such as adhesions. Call your child's nurse or doctor. Emergencies. If your child experiences any of the following things, contact your child's surgeon or ostomy nurse immediately or go to the nearest emergency room. A deep cut in the stoma. Severe color change in the stoma from bright red to a dark purplish red. A large amount of continuous bleeding, over 4 tablespoons into the pouch. No output from the stoma.